We're right in the middle of the worst shortage of workers in modern times. Where did millions of American workers go? That's a great mystery that remains without an answer. With each passing month, thousands more workers simply vanish from the system. But all over the country, we can see help wanted signs as businesses scramble to hire new personnel and resume their normal operations. The number of people currently employed is still close to 4 million below the peak of the health crisis last year. So what has really happened to all of those extra workers? Before you start thinking that they're probably unemployed, recent data shows that this isn't what's happening. Unemployment claims are at the lowest level in decades. Even though seasonal adjustments and health crisis-induced distortions can have an impact on official figures, economists are saying that today's low level of unemployment is not as rosy as it seems. It is not an indication of a strong and resilient labor market, but it can actually underscore that we have a weaker labor market given that there are fewer participants helping businesses to provide goods and services to consumers. The labor market is facing a severe crisis, and our economic growth is on the line. Over the past couple of years, millions upon millions of workers have completely disappeared from the system and never came back, even after government stimulus programs have expired. As a consequence, this lack of workers is impacting all of our major industries and sectors. For instance, some of the largest banks in the United States are closing thousands of branches around the nation due to a shortage of staff members. Some big names, such as Wells Fargo and JP Morgan, recently announced the temporary shutdown of thousands of branches due to labor shortages and the new wave of confirmed virus cases. This is a new event of widespread branch closures that mirrors what happened at the start of the health crisis in March 2020, when many thought that lockdowns would only last for a few weeks. The fresh round of closures has already started to spark anger, frustration, and confusion among customers. Banks are telling us that if your local branch is closed recently, it may be quite a while before it opens again. Even Bank of America is warning their customers that some locations will remain closed indefinitely. Many of our locations may have reduced hours, says Bank of America, alternate days of operations, or may have been temporarily closed. Bank of America wrote this in a note to customers on its website, continuing to say, "We are doing everything we can to reopen as soon as possible, though some locations may remain closed for an extended period of time." In a press conference, Bank of America spokesperson Betty Reese highlighted that the bank's temporary financial center closures have occurred in areas where they're seeing fewer visits or where their staffing is not sufficient for all to remain open. The chaos happening in our healthcare sector right now is even more alarming. Staffing shortages are pushing some hospitals to the brink of financial ruin. Thousands of hospitals around the country are having an extremely hard time delivering basic services right in the middle of this new upsurge of virus cases. The number of qualified workers has been steadily declining, and the cost of hiring replacements is pushing some facilities straight into bankruptcy. In a recent Bloomberg report, analysts of the sector are telling us that the healthcare profession is suffering its own great resignation, and with each passing week, more and more hospitals are falling into deep financial distress just as a winter wave of the virus emerges. That's what has happened in the Watsonville Community Hospital on California's Central Coast. The facility's costs became too much to bear, and at the beginning of this month, the hospital filed for bankruptcy. All over the nation, hospitals are buckling under the strain of nursing shortfalls and the skyrocketing cost of hiring replacements. This is the worst nursing shortage that I have witnessed in my career. Maureen May, a 30-year veteran of the pediatric ICU in Pennsylvania, revealed in the interview. The shortage of nurses is so acute that when a professional becomes available in the market, oftentimes hospitals are having to engage in bidding wars to offer the most attractive paychecks, and of course, the facilities with the biggest checkbooks end up winning. This is like survival stakes, said Stephen Schill, head of the healthcare practice at advisory firm BDO USA. Winners are whoever's highest on the food chain and who has the biggest checkbook. The staffing companies, agencies that provide nurses and other staff on a temporary basis are really gouging hospitals, he added. But the pain spreads way beyond nurses. A report released by human resources firm Mercer found that there's a shortfall of 3.2 million lower-wage workers in the healthcare sector, including nursing assistants and home health aides and many other maintenance professionals. Unfortunately, we can't say this crisis comes as a surprise to anyone. For years, healthcare workers have been struggling with chronic underpayment and exceedingly long work hours. And to make things worse, the vaccine mandates caused the layoff of thousands of professionals before being annulled late last month. The states with the strictest measures are now seeing severe personnel shortages, and several institutions are in an unsustainable situation now that the health crisis started worsening again. Needless to say, the ones that enforce these mandates in the first place are responsible for this unprecedented mess. At the same time, a worrying number of patients continue to check into hospitals with conditions that no one can explain. In Ventura County, one hospital is recording a massive increase in the number of people coming in complaining of unexplained heart problems, strokes, and blood clotting. One ICU nurse identified as Donna exposed that the number of sick, critically ill people in the hospital has become overwhelming, and it is pushing the facility's patient census to the highest levels she has ever seen. Donna stressed, "It has never been this busy, and none of it is the virus. We don't normally see this amount of strokes, aneurysms, and heart attacks all happening at once. Normally, we'll see 6 to 10 aortic dissections a year. We've seen 6 in the last month. It's crazy. Those are very high rates of mortality. Because we're short-staffed, they're hiring new nurses, and I'm seeing mistakes in the hospital that are not even funny. Medical errors," Donna continued. "Hospitals are trying to fill these spots and are getting any warm body to do the bare minimum. I think it's terrible what's happening." Another ICU critical care nurse at the hospital came forward in an interview with The Guardian, saying that she's tired of all the BS that's going on. The nurse, who identified herself as Sam, highlighted that it's crazy how nobody questions anything anymore. None of the doctors question what is causing myocarditis, pericarditis, and the strokes that are coming in. If they don't toe the line, they could lose their medical license. Everyone wants to downplay it, saying that it's rare, Sam reveals. Doctors don't want to question it. We're seeing myocarditis more frequently, and nobody wants to raise the red flag. When we discuss the case, they don't even discuss it. They don't mention it. They act like they don't have a reason, that it's spontaneous, she added. Similar situations are happening at countless other facilities all around America, and the situation is likely to get worse because many hospital staff members are threatening to quit their jobs in the coming months. A recent survey conducted by the American Association of Critical Care Nurses found that staffing shortages are about to intensify, as 2/3 of nurses in the country said that their experiences during the health crisis have prompted them to consider leaving the field. Nearly 21% of them said that they plan to resign within the next 6 months, while 29% said they might. Meanwhile, the air travel industry is also suffering from serious staffing shortages. During the past week, many airlines have experienced a nightmare scenario as millions of holiday travelers crowded airports, but a lack of enough workers led to mass flight cancellations. Even after Christmas was over, travelers still faced intense airport chaos as 913 U.S. flights were canceled on Sunday and 2,975 more were delayed due to a shortage of workers. The new wave of disruptions comes after roughly 1,000 flights into, out of, or within the United States were canceled on Christmas and more than 3,000 were delayed. According to the Daily Mail, some customers disclosed that they were left waiting on planes for hours without updates. Others revealed they were left waiting in long lines to check into flights, while others said flights were just flat out canceled with no warning, leaving them stranded for the holidays. This is another crisis that is not going to be solved anytime soon. We may have been losing people at an extremely alarming pace, and the resurgence of the virus is making many professionals afraid of coming back to their posts. Recent data released by the U.S. Census Bureau found that the U.S. population increased at the slowest pace ever recorded during the 12 months ending on July 1st, at a 0.1% rate, marking the lowest level on record, and outlining how the health crisis is changing the nation's demographic patterns. The report says that America added only 393,000 people in the year that ended July 1st for a total population of 331.9 million. When the final numbers for the full year of 2021 are released, economists expect to see a steep decline in the country's overall population. Unfortunately, many have fallen victim to the virus and many other diseases, disasters, and accidents in 2021. And the most gut-wrenching aspect of this situation is that this is just the beginning. Our entire society has already started to fall apart all around us, and we've only started to feel the impacts of that. We have just gotten to a stage where even our most basic services are starting to falter. And when it comes to 2022, we should expect for the worst, because our ongoing crises are only aggravating and our leaders remain asleep. Thank you for watching this video. If you found it informative, we would like to recommend 7-Year Apocalypse, the latest book from the economic and financial analyst Michael Snyder. Please don't forget to turn notifications on and keep tuned for our next videos.